Which is the first one, the major one?
Gluteus maximus. The big one.
Gluteus maximus. This is the main muscles, right? And they
Inside
are
muscles also. Inside one also.
no. Gluteus maximus is the main muscles. And there are three supporting muscles. Which muscles? Hamstring. Whole hamstring group is supporting muscles for hip extension. Okay? The gluteus maximus is the main muscles, and the hamstring muscles, which is the bicep femoris, semimembranosus, and semimembranosus. These four muscles are the supporting muscles. Okay?
Yeah.
So, hip extension means we are going to move this shoulder. Understand? And hamstring is start from here to here. Understand? And glute is start from the here and it's connected with here. Okay? The sum of the part glute is connected with your sacral and sacral part, then connected with your hip bone and connected with your femoral head. Okay? When this muscle will contract, then your leg will rise like this, and this also muscle are contracting. This also muscle are contracting. So major muscle is only this one, and these three muscles are the supporting muscles. Okay? So always remember this: hip extension plus knee flexion. They both are supporting each other. The hip extension and knee flexion muscles. These both muscles are supporting each other. And hip flexion, the supporting muscles are knee extension. Got it? In the knee extension, only that muscle which is connected with three bone. The hip extensions is glute maximus muscle. Supporting muscle, the hamstring group. Which muscle? The main muscle of the hamstring group, which is connected with three bone. So this all are connected with three bone hamstring. Okay? So hip flexion. When we come on the hip flexion, the supporting muscle are knee extension. Which one? Only rectus femoris. The main, because the vastus group is start from here. The vastus group is not starting from the hip bone. So only that muscle which is the start from the hip bone, that muscle will support for hip flexion and hip extension. Got it? So in hip flexions you can write here which muscles are major muscles. So it's major first. Now hip flexion. Then iliopsoas. Iliopsoas and psoas minor. Okay, you can give a 3 star to these muscles. This one is 2 star. This one is single star. And the supporting muscle is rectus femoris.
Why iliopsoas?
This is supporting muscle, not come under this groove. This comes under here, no? Okay, and supporting for the hip flexions. But these three muscles are here only, in the hip only. Okay? So, if you see for the hip extension, the main muscle for the hip is only one muscle. For the hip extension, the main muscle is only one, which is your glute muscles. what we have the hamstring groove, actually their muscle are the knee flexion muscle. Understand?
Yeah.
But they are supporting for your hip extension too. Okay? So that means we don't have too much pressure on the glute muscles. When we are sitting, that time we give the more pressure. For example, when I am going to sit like this, the maximum pressure is coming on the knee extension and hip flexion. Okay? If you are sitting like this, you are going to get up, the maximum pressure is coming on the knee extension and hip flexion. Because this muscle going with gravity. These muscles are helping to comes out against from gravity like this. So this muscle need more strong.
And when you say hip flexion, you mean the psoas muscle, right?
Yeah, so in hip flexion we have the psoas major. Second muscles we have the iliopsoas, and third muscles we have psoas minor. Okay? And the rectus femoris is hip extension muscle, that is supporting muscle.
So the sauce means sartorius muscle, no? Sartorius muscle.
No, sartorius is different muscle.
But it also connects from this hip and
Sartorius comes like this.
Yeah.
That help to rotate your hip. When we are doing like this, no,
Yeah.
the sartorius will help. When we are coming back, sartorius will help. Okay. The sartorius start from the mid of the knee and coming on the lateral side of the hip. Okay. This what we are talking this is only for flexion. We are doing the knee flexion like this. These muscles are only for this knee flexion. So hip flexion. Adductor. The name of the adductor means adduct. Do the aid, which means for adduction. This is adduction. This is abductions. Okay. Flexion means this is the flexion, and this is the extension. Okay. Okay, we'll go a little bit more into depth. Connected with the T12. The rib is connected with the floating rib on the T12. Okay? trying to draw. So where is psoas major muscle? Very important muscle. So psoas major muscle is very important muscle.
Deep muscle.
Now you will understand which muscle are supporting which one. Okay. Now the very basic. If the glute maximus muscle become the weak, then hamstring muscle are overworking.
Say again, please.
If glute maximus muscle
Is weak.
become weak,
Yes.
then your hamstring muscle is overworking.
It's not what?
To compensate.
Oh, it's overworking.
Yes. So it becomes.
So, psoas major and iliopsoas, they are affecting through rectus femoris also, or maybe rectus femoris effect through that. They both are supporting each other. Okay, we'll go in a little bit more deep. So, where is psoas major? It starts from the origin. It starts from the
Here.
Yeah.
no the name, the location name. Psoas major. It's a huge big muscle. The maximum lower back pain issues is connected with psoas major only. It's a very thick muscle. Okay? It starts from the L1. Little bit filament is going till T11.
Oh.
Okay? It's mostly starts from L1 like this. Okay? Filament is coming with L2, L3, L4, L5. Got it? They are coming like this, this, and it comes to here. Okay? Got it?
This is source major.
This psoas major. So some of the filament is like connecting like this, going on the vertebral body like this. Okay?
Yeah.
And the filament is going like this. Some of the filaments only. Okay, fascia. You can say fascia is going like this, covering the whole this area. And psoas major fascia is directly connected with the diaphragms. The diaphragm,
Yeah.
the diaphragm's filaments. For example, this is the diaphragm. Diaphragm's filament is coming with like this on the spine like this, and psoas major fascia is going like this. The both fascia internal connected. So that's why whenever someone having like acute spasm pain or too much stiffness in psoas major, they having like difficulties in the breathe. They are not able to breathe properly deep because of whenever they breathe properly deep, they feel pain more. Okay, because both our filament are internally connected.
And this happen with people that have big bellies, because the weight here contract the spine.
So
right? And
when
then-
you have like more belly, for example, like this, of course your body is trying to fall down from interior part. Okay, and this backside muscle, not psoas muscle, because psoas is on the anterior part. Okay, this muscle are helping to hold more your body like this. Okay, so backside of the spine muscles, when we come on the trunk extension, they muscle are holding more to not fall down, because heavy belly, then you should live like this. Then this muscle are fully contract. Okay, if this muscle is contracting, then you will go like this. Okay, this muscle, where is this muscle actually? Inside the transverse process here. This muscle is start from here, going like start from the here, going like this. From this gap, it will reach here on the femur bone medial side. Here.
Goes-
Yeah. it's going like this.
Okay. Yeah.
Okay, when this muscle will contract, they will lift your leg like this. Understand?
So the psoas travels from outside, it comes inward to the
Outside
diaphragm
means?
from the backside.
No. What I said, this is the transverse process. Psoas major muscle is the interior part of the transverse process, not the posterior. Can you see this bone? Psoas major is the only muscle who is attached with the inside of this transverse process bone. So where is psoas major? Like this to my marker, this is the psoas major.
Yeah.
In the front.
In the front. Okay? The side of this side of the disc. This is disc, no? The side of the disc is going like this, and it will reach like this too. Okay? So in this muscle we'll talk about the uterus, urinary bladder and lower intestine because this directly attached with that. If you having like constipations, so in the constipations, the intestines will be little bit enlarged, and that is touching your psoas major. Psoas major is very sensitive muscles. If someone having the constipations and they have a lower back pain, okay, that is due to gas, and that intestine is pressing your psoas major. So in that condition, mostly we do the first treatment for constipations, then we do the treatment for the psoas major. There are some acupuncture point dimensions like if you insert needle here for the REN4, that's good for lower back pain, but not for the all case. Okay, the lower back which comes from due to your bloating and gas. Only in that condition the needle will help to reduce the lower back pain issues.
So sir, this origin is from lumbar or thoracic where?
Yeah, mostly the main muscle filament is attached from the L1.
Yeah.
Okay, but some of the filaments,
Yeah.
the fascia is going till T11, and the upper parts, the diaphragm fascia is coming till T12. So they both fascia internally connected.
So, but it is origin is from T12.
Originally from the below the T12,
Yeah.
mostly from the L1. Okay, so some of the filament is coming out from L1, some on L2, L3, L4, L5. This muscle is connected with lumbar 5 vertebral column.
Yeah.
Then going in the insertion part is the head of the femur bone. Got it? So how I draw exactly like this. The muscle is going like this.
After the greater torticollis of this. Femur.
In the femur. Yeah. Okay? This is the deep muscles. This is the deepest muscles. On this muscle, how many muscles we have? Latissimus dorsi. If you are targeting from the side, then iliocostis lumborum. If you are targeting from the center, then longissimus thoracic, which is second layer. Then if you go upper, then there is like this muscle is no, one is QL, which is cardiatus lumborum. These three are the major muscles. Then fourth muscle is your psoas major muscle.
That's why you have to press to stand here.
So
like
this
that.
muscle, it's difficult to diagnose through the press. So we have a different technique. We can press only superficial muscles, which is the first layer muscles. If the second layer muscle, if you are pressing, then you are just hurting the superficially. Of course, the pressure will not go till the psoas. So connected with many bone, right? The psoas is connected with many bone. Understand? So mostly like we count the spine 1 and your bone, the hip bone 2 and femur bone 3. So the pain will radiate toward of origin part. Then the people having the more pain here near the spine. Okay? They are complaining pain more here and they will complain this deep pain. Okay? They will feel good relief after doing some movement. For example, if they are doing like this, now I am feeling a little bit of the good relief. Understand?
Yeah.
Because deep muscles, we can't figure out through the press. When you are pressing, it will not reach the pressure till the psoas major. So what they will do, when they are doing stretching, yeah, now I am feeling the relief. Okay? So who is having the more issues? Who is sitting for long time? Driving the bike or car or driver? If not good road,
If they have hip pain, like it could be because of the tightness in the psoas.
hip pain mostly will go with the abduction and adductions more. Yeah, psoas will not give more hip pain. For example, now my psoas is stretched. It's like in normal positions, okay? When I sit like this, what is conditions of my psoas?
Flexion.
It's contract. I am
Yeah.
using the break like this.
Flexion.
It's gonna stay.
Too much of the contraction, relaxation. Understand?
Yeah.
And if there is like Indian road, the bed road, then you going like this, again there is like lots of the contraction, relaxation on the muscles. So then people having this. That's why driver who's trying to go, they walk like more like this. After the 10-15 years of the driving, they walk a little bit like this. And when they are sitting, for them very difficult to get up and straight like directly this. They will do like this, slowly, then they will relax. That is the psoas major.
That's
Okay. Second is the important muscles. That is your iliopsoas. Which one? Iliopsoas. Psoas major is start from the spine and going to the femur bone. Iliopsoas is start from the half of the way. Okay, so it start from like here, inside the whole iliac bone, and going again in the same. Insertion is same, right? The insertion part is same. The origin power is comes from different area, but the insertion part mostly maximum on the same locations. So this is the your iliopsoas.
And finish is in the same spot as the psoas major. They finish together in the same spot.
On the same spot. So this muscle is connected with the how many bone?
Two.
Two bone. Then pain will radiate toward of
Insertion.
insertion. Where the patient will feel pain?
The femur.
Patient will complain, I have some pain here.
Tailbone.
No, the
Yeah.
ischiac.
This is the anterior body. It's not possible.
In groin.
Yeah,
Yes.
this is anterior body, okay? So they will, in Hindi they call it नस चढ़ जाता है यहाँ पर बोलते हैं नस चढ़ के फिर वो ऐसे walk नहीं कर पाता है guy is walking like this they say there is some नस चढ़ जाने क्या बोलते हैं English में
There's no.
No, cramping.
You can say.
cramping is different
इसको सर?
No.
नस चढ़ जाती है ऐसे
No, not
So-
Pinch.
Yeah, pinch.
yeah it's like pinch
Yes.
there is my pinch so they are not walking straight they walk like this like on the side leg they can't do like this and mostly this is happen with animals more.
Oh yeah. The
Okay,
back.
so
the back.
so the cow is walking like this. The leg is not doing flexion. They are just just doing like this. So the all people they go like this, okay, and they tuck, and then the cow is walking.
Oh.
Yeah, there are many like this. The local people they used to do this. Okay. Yeah, so many times this happen with, for example, when we are riding bike sometimes, and suddenly we get the catch,
Yeah.
and then we'll go, then we'll do like this stretch, then it's go.
Yes.
This is the happen due to your iliopsoas. So whenever you are having the difficulties like this, okay, and when you are flexing your full like this, and you feel the pain here in the groin, here pain, this one is for rectus femoris. Okay, the pain is coming here, that is your iliopsoas pain. Okay, someone will complain the pain here, but this is the adductor group. So, but the insertion part of your iliopsoas, the pain of here, that's iliopsoas. Okay. Mostly this pain is happen over here in this part. Okay, because where they are attaching, this is not joint. Where is the joint? Joint is here. So this mostly happen here more. Okay, inside the joint here.
Yeah.
Right?
Is the insertion for the iliopsoas muscle, is it the ischial one? The insertion?
For iliopsoas?
Yeah.
On the same point.
Femur.
Yeah. Now the third muscle is your psoas minor. That is not that much important. Okay, it's difficult to target also. And for example, these both muscles are helping more hip flexion. Okay, but iliopsoas is helping a little bit more the hip and trunk flexion. When you are doing like this, no, then that iliopsoas is functioning. The very small tiny muscle which is start from the L1 and L2 and it is attached here. Okay?
Psoas minor.
That's psoas minor. It start from the L1, L2 and attached here. Okay? But the measure these two complaint you will find in many cases. Okay? So starting, see again the same two muscles. One is long one. The insertion part is the same. The one muscle is the long one and second is the short one. So how they will work? They start in 45, the psoas major, and if they having the issues with like minor flexions, then the iliopsoas. Starting 45 degree, psoas major, and rest the psoas minor. Starting 45 degree hip flexion that comes through your psoas major and rest 45 degree it comes from your iliopsoas.
Or psoas
Right?
minor.
So it's minor.
Sorry, major. No?
Then
The psoas minor is only in that condition when we do like this, no?
Okay.
This is not supporting more in the hip flexion. When you are doing trunk flexion with the like hip flexion like this, only in that condition psoas minor will respond. So you don't need to remember the psoas minor, just keep the side. Just focus only on the like psoas major and iliopsoas. These two muscles are more important. So sometimes when you insert needle inside the psoas major here from the back side, and the patient will come, oh, something went here. If the muscle is very stiff, no, when you are inserting needle in the psoas major, there's some electric shock and the vibration is going till your femur bone head.
So someone who can't squat down though, they have problems with their psoas minor.
Someone with it?
Who can't squat. To go, you know, the way you're...
This?
Yeah. If they can't
No,
do that.
see, again for this, these two muscles are the responsible psoas major and psoas minor. Iliopsoas. Psoas minor is, I said no, like only just 5%, 7% helping.
Oh, just that amount.
Yeah, just that amount. Again, when you are doing like this, again your psoas major and iliopsoas is responding.
Okay.
Okay?
So someone sits on the chair for a long time and he's trying to get up, then he has to, he'll get up after 5 minutes.
Yeah, that's the psoas major stiffness. Okay?
So, for example, if someone passed too much time in the computer sitting down, they need to, this muscle becomes weak,
Yeah.
right? And
Not weak, muscles become more stiff.
oh,
Because if you see, when you are sitting, muscle is contract or relax. Muscle is contract, and you are keeping muscles for contraction in long time. The muscle is like this, it's fully contract. For example, if you keep your hand for long time like this, the muscle filament all contract, then more stiffness will happen. Okay, if you are relaxed, for example, you are not using that muscle, then weakness will come.
oh, okay,
Alright? Done? helping muscles. Okay? For example, when you lie down, if you are lifting your leg, what you are doing? Hip flexing. But the rectus femoris is supporting. When you are sitting like this, okay, going to get up, doing the like hip actions and slowly, this will help you. When you are going down, the rectus femoris is supporting. This muscle is supporting this. Okay? We target both. That is main muscle for knee extension.
So squatting actually strengthens the psoas muscles more than anything else. Also correct.
Squatting mostly help more the hip knee extension and hip flexion.
So both muscles are.
Both muscles. The joint are always like opposite, going like this. One see. This is extension, then flexion. Okay? This is the flexion and this is the extension. They are supporting each other muscles like this. Okay? Now, how I draw, the blue color is disc. Blue color is disc. Just around the disc, left side one muscles and right side one muscles. If one side muscle becomes stiff, there are many causes stiff. For example, if I put my pocket here and if I sit like this, okay, then my one choice is contract and one choice is more stretch. Understand? After slowly for a long time, one muscle becomes stiff. So whenever one choice major muscle becomes stiff, what will happen? This filament will start to contract, right?
Yes, tighten.
One side the muscle is more tight. When the muscles are more tight, they are creating the more pressure on the
This.
disc. Whenever there is psoas major muscle is stiff, there are very high chances for slip disc. There is very high chances for slip disc. Second, if this both are psoas muscle become the stiff, then the people having issues with disc degeneration. That means the both side muscle are contracting more and they are creating the equal pressure on the disc. The volume, the size of the disc will reduce. Slowly, the size of the disc will reduce.
So people who stand a lot. Standing, if you stand a lot, then pressure is
Yeah, if you are standing for a long time, that is also psoas affecting. The third one, if your psoas is stiff, the psoas is here, right? So our spine is like S shape. Now this part comes more on the anterior side. Understand? When your psoas becomes stiff, then what will happen? They are pulling more spine toward of the
Back.
To the other end.
The part.
inside.
yes, the front.
Right? This muscle are here. When this muscle becomes stiff, they are pulling this area more inside.
Okay.
So for those people who is lying down on the stomach, if you see the lumbar region is like this.
Yeah, yesterday.
Yeah.
They having like the psoas major stiffness. Some people are when they are lying down like this straight, and there is full gap between the floor and between the bed and the spine. There is full gap. If you can put hand like this. They having the psoas major stiffness. Understand? So whenever the patient is lying down on the stomach, if you see the spine is going more deep, but the side muscle is a little bit more coming like up. The side muscle is more out and the spine is more deep.
Yeah.
Okay? We'll check now, maybe we'll find something. Okay, so always remember the psoas major pain radiate toward of the spine. Side of the spine if there is a pain, okay. If you will press, you will not feel that pain. Through the only stretching, the patient feels, yeah, there is pain or there is relief. Okay, iliopsoas pain will radiate toward of the groin. Rectus femoris pain will radiate toward of the hip. Here. Okay, this is the combinations of your hip flexion muscles. Psoas major muscle can be so iliopsoas muscle can be affected through your ovary. Okay, because ovary is just on the your iliopsoas muscle. When girls having the period, and if there is a little bit more painful and inflammation in the ovary, okay, that time they having the more pain here and here. This whole area is more painy. Okay, they are more affecting your psoas major and iliopsoas. Okay, and iliopsoas muscle for the constipations. If the constipation, that time also iliopsoas is suffering with some kind of the discomfort. Okay, and one more, urinary bladder issues. If some people having urinary bladder issues, they also affect the iliopsoas.
What, like UTIs, is it?
Urinary bladder
Yeah.
means the frequent urinations or any infections in urinary bladder. That time also iliopsoas muscle become organized. Now the muscle are only here, but we have to target on the two different positions, because psoas major we can't insert needle from the anterior part. We'll insert needle from the back side, and for the iliopsoas we'll insert needle from the inside. Okay, so one session we'll do from the back side. Okay, then second session we'll do from the front side.
Accessing psoas from the back is hard because it is more in the anterior part. Muscle is more anterior. So when you are putting a needle from behind, how do you find it?
See, psoas is here.
Yeah. Oh, okay.
We'll insert needle
To
from
the quite a bit to the side. Okay, okay.
where is psoas? This is the psoas,
Yeah,
and we'll insert needle from the here,
yeah. So two,
because we are crossing the whole muscle.
so 2 or 3 to the left of the or to the right of the spine.
Yeah, so psoas is exactly like around 2 and 2.5 tune thick from the spine.
Now I get it. Okay.
Okay.
In half to.
Yeah. Some people like it, thin people the less develop, then around 2 tunes, and more developed then 2.5 tune. Okay, so we'll go for the, if you want to target the psoas major, always try to go from the spinous process 1.5 tune. From the spinous process, this is the spinous process, from the here 1.5 tune. Then you directly reach on the psoas. If you are going from the lateral side, you can reach very easily. If you are going straight, okay, then you have to follow the one tree. There is transverse process. If you are going like this, maybe you will touch needle transverse process and you will see, oh, needle is touching one bone. So what you will do, just try to go on the tip of the spinous process.
Okay, that
Tip of the spinous process and 1.5 tune lateral, and go from there. Then you will pass needle through the between the two transverse process.
Yeah. Smart.
Understand? We'll do practical now, okay?
Yeah.
If you are targeting from the side, you can target, okay? Mostly I target from this side because psoas is more thick like this. Understand? Psoas is more thick like this. If you are targeting from the here, then this is the spinous process. Okay? You go on the top of the spinous process. So there is one tip, one tip, one tip, one tip. So go on the tip of the spinous process and 1.5 tune lateral. 1.5 tune lateral, and directly insert needle from the hair straight. Now you are crossing the psoas. Whenever you cross the superficial muscle, there are 3 to 4 layers of muscle. No? When you cross the superficial muscle, no, that is not that much thick muscle or steep muscle. But whenever you touch the psoas major, your needle become little tight. Okay? Then when you press little more hard, the needle is still tight. and that muscle is more sensitive muscles. So sensation, when you touch that muscles, the different sensations the patient if you feel that or some electric sensation going in my leg. Okay, because many now is going to your psoas major muscles from the anterior part, not from the posterior or middle part. So don't worry, you are not going to insert needle inside it now. Okay, so when you will touch, the muscle will give mild spasm. When the muscle will give mild spasm, the sensation will go into your nerve. Okay.
Any precaution we have to take during this? Any precautions?
Don't go more deep in psoas major muscles. Okay, when you feel the steep, no, go half tune more deep. That's enough. Because we already discussed that's very sensitive muscle. Sometimes when you insert needle in the psoas major, the patient will complain, I am feeling a little breathless.
Oh, that is the diaphragm.
Okay, because it's stimulating the diaphragm.
Yeah.
Okay, then you can take out the needle. Okay, or you can give the mild stimulations on the back side of the T8, T9 here. Okay, do dilate with this to release the diaphragm. Okay,
But with the needle out.
if you are not taking out, then you can do like this. Okay, if you are taking out, then automatically that breathless will go.
Which vertebrae you, or which part
Tapping.
of the spine? No, are you going to insert the
Yeah,
needle?
that's a good question. Mostly we'll go between the L2 to L5. Okay, L3, L4 is good, L4, L5 is good. Because that is the major motor area.
Around L3 or 4.
Because in this muscle we are not able to find the weakness and stiffness and trigger point. For that you have to take hand inside and find where is trigger point.
So we can insert needles on the groin area for ileus neck.
Will you need 60? Because it's deep.
Depends on the
75.
What?
75.
70.
For this person we use the 60. Okay? Because each and every muscle is around 1 inch or half inch thick. So we are going across in the 3 to 4 muscles. Okay? If anyone having lower back pain,
okay, another model we different models today.
you have lower back pain, right?
Left side.
Left side, come.